So we wanted to mention a few things about particles and health concerns. There's a huge diversity of particles and where they're coming from and what their composition is. There's a lot of diversity in terms of toxicity as well. And there can be adverse synergy with other co-pollutants. So unfortunately, it's not even, when you're thinking about the particles in your home, the impact that they can have just in terms of their toxicity can be affected by the other air pollutants that you have in your home. And fine and ultrafine particles can be vehicles to increase exposure of some of those other toxic contaminants like semi-volatile organic compounds or metals. And so the premise at ROCIS is the precautionary principle to avoid or minimize your exposure as much as possible. And this premise is supported by a clear concentration-response relationship between particle pollution and health effects that has been established by scientific studies. And it takes a lot of high-quality, reproducible research to establish this kind of dose-response relationship. And what this figure that you see just broadly emphasizes is that studies have found that as particle pollution, which is represented on the vertical axis, as that increases, the impacts to human health on the horizontal axis, those increase as well. And one thing that you probably notice here is there's no magic threshold in terms of particle numbers for which you can say, for example, well, as long as I only have 500 particles per cubic centimeter, then I don't have to worry. So truly, lower is better. And as Linda mentioned, the great news is that there are many things you can do to lower your exposure to particles. This map on the right is from a study that looked at the percentage of total deaths due to PM 2.5 and ozone. And the colors ranging from purple to red represent purple being less than 3% of total deaths attributed to PM 2.5 and ozone, all the way up to almost 10% of deaths attributable to PM 2.5 and ozone in the red. And if you notice, Pittsburgh is there in the red. And we also have, this is a quote from another study that came out last year. They said, our best estimates of the U.S. mortality burden associated with total PM 2.5 exposure in 2012 range from 230,000 to approximately 300,000 deaths. And so the first question we have on the screen here is there a safe level of radon exposure? And the World Health Organization does recommend 0 in terms of a level of exposure. So we are talking about increased exposure to radiation, and there is no safe long-term level of that. So just a recap of what radon is. So it is a radioactive gas that forms naturally when radioactive metals, such as uranium, break down in rocks, soil, and groundwater. And the greatest exposure occurs indoors, especially tight and or insufficiently ventilated structures. And it is associated with an increased risk of lung cancer and is the #1 cause of lung cancer in non-smokers. Why is that? That's because cancers from radon are produced by they're called their daughter decay products. And these decay products adhere to the delicate cell lining and passageways and can damage sensitive lung tissue. So there's a 50% risk. There's a 50% increase in the risk of lung cancer at the EPA level of 4 picocuries per liter, which we mentioned previously is the recognized action level by the EPA. And there is a synergistic risk effect in smokers. So what that means is that if you consider the risk of lung cancer in smoking and you consider the risk of lung cancer from just radon exposure, the combined risk of radon exposure with smoking is much higher than you would expect if you just combined the risks from those two things independently. And the risk to being exposed to secondhand smoke sits in between that of non-smokers and smokers. So this table is from the EPA, and it is communicating the risk to you if you have never smoked from radon exposure. So if 1,000 people who never smoked were exposed to these levels of radon over a lifetime, these are the number of people that would be predicted to develop lung cancer. And again, we emphasize that this is assuming a lifetime's worth of exposure, but you can see that at 1.3 picocuries per liter, they would expect about 2 people to get lung cancer due to radon exposure out of 1,000 people at that level. And then you go all the way up to 20, and at that point, the estimate would be about 36 people out of 1,000 would get lung cancer.
You had a comment about radon that I thought was interesting, and it was somebody Bill Angel, who's done a lot of work with the World Health Organization. The point he made was that half of the lung cancers from radon in the United States were from people who were exposed to levels lower than the 4 picocuries per liter. And he said that's because the 4 picocuries per liter, is that much less common if you consider distribution, like a bell-shaped curve distribution. There are so many more houses between 2 and 4 than 4 and above. So even though the risk is lower, almost half as low down at the 2 picocuries, there's so many more houses that it actually results in population-wide that many more lung cancers. I had the opportunity to be at a national training for Habitat for Humanity on radon, and the point that was made was that this is the most cost-effective way to reduce a cancer death of any of the contaminants in our environment. And that the level of 4 picocuries per liter, the action level, was set a long time ago, like 1990, I think, or even before that. And it, was based on, well, what will it cost to mediate cancer? So it's not based on this is necessarily the right level. It was just a cost effectiveness analysis. Don, do you want to have anything to add to that?
Canadian levels have historically been higher because Canadian government officials were even more cautious about imposing a huge financial burden on Canadian homeowners. So there's a lot of politics involved in the setting of these limits.
Well, you were at 10 for years, and then didn't Canadians set it down to, well, we'll get to that later, but to a much lower level once the epidemiological evidence came in, right?
Yeah.
So this first question is sort of just to emphasize that you may not hear that much about exposure to CO2 in terms of whether there's a safe level of CO2 exposure. And as you've heard previously in our webinars, between 400 and 600 is pretty typical. And if there's long-term readings over 1,000 parts per million, that's when we start trying to figure out maybe what's going on with your ventilation or other aspects of your home. And there's a study that we have here looking at some of the impacts that exposure to CO2 can have. And in this study, their participants were exposed to 3 different levels of CO2. So they were exposed to 600, 1,000, and 2,500 parts per million. And they were in an office-like chamber. And as they were exposed to these levels of CO2, they were completing a computer-based test of decision-making performance and questionnaires. And the next slide has one of the figures from the study. And just to kind of get oriented, on the vertical axis, it goes from dysfunctional at the bottom to superior at the top. And so that's a measurement of the decision-making performance. And then across the bottom horizontal axis are the different categories of activity and performance that they measured. And so, for example, in this first column, you can see the white dot corresponding to the lowest level of CO2 that they used as an exposure in the study. corresponded to the highest levels of performance. And then as you go down to 1,000 and 2,500 parts per million of CO2, the performance levels decreased. So there was a range in this case from marginal performance to superior performance. And they saw that similar pattern across all of these types of activities with the white dot on the top and the black dot on the bottom. And the one exception to that was you can see in focused activity, it's the third column from the left where the black dot is on the top. And the authors of the study said that that actually made sense, that focused activity, that the performance in that category would be higher for the people who were exposed to the most CO2 because high levels of focus under non-emergency conditions can actually indicate overconcentration. And there's been a lot of research that has shown that people who experience difficulty in functioning, like if someone has a mild head injury or if someone's under the influence of alcohol, that they tend to become highly focused on smaller details at the expense of the big picture. And so that is what they believe they were seeing in this case as well with CO2. This was in case anybody was curious about how they defined these categories that they were measuring performance in.
One thing that I think is important to recognize is that the elevated CO2 in this study was only looking at the impact of CO2. They controlled for anything else, whereas CO2 is sometimes seen as an indication of how much ventilation is in a space or how many people are in the space, because people are the main source of CO2. And in the second case, sometimes elevated CO2 would be an indication of ventilation, particularly or low ventilation. So that's, in one case, it's the proxy for a possible problem. In the other case, in the case like of this study, it's actually saying that lower levels of CO2 are beneficial. But I know that Portia, a lot of the stuff that Women for a Healthy Environment addresses are all the things we don't measure in homes. And there are many things we don't. So the issue of ventilation would dilute those things that you don't necessarily have an easy way of measuring. Do you want to build on anything, Don?
Just to say that at the end of the cohort, we see your whole CO2 download, and it's a lot easier then to look for patterns. So if your CO2 is high only in the morning when you're getting up, and then it goes down to, well under 1,000, then you can figure out a ventilation strategy, especially if you had like a bathroom fan that was on a timer or something like that. You could figure out a ventilation strategy that would deal with just the problem times and not be running all the time. We have seen CO2, very high CO2 in some of the participants, up to 6,000 ppm, I think. And in that case, it's actually going to affect thinking to quite a large degree. But if your data is normally in the hundreds and once in a while jumps up to, 1,200 or something like that, that seems like pretty normal in houses and may not need any particular remediation. So I will be giving you a report after the cohort on what I notice in your CO2 data and whether I think you need to change anything in the way your house operates to compensate for that.
CO2 is being used as a sort of proxy for ventilation in schools and buildings during COVID times, and they're actually recommending lower levels of CO2 to indicate a well-ventilated space. So I think they're talking about 500, 600, 700, which is pretty well ventilated.
So there's lots of potential sources of carbon monoxide in the house, and they all basically deal with combustion, with something being burnt. So if you have gas or oil-fired space and water heaters, if you have a gas dryer or a gas cook stove, if you have a wood stove or a fireplace in the house, all these things are burning something, and in the burning, they can create carbon monoxide. They don't always, but they can. You can also get carbon monoxide from especially heavy smoking inside a house. And if carbon monoxide is created in garages through starting up a vehicle in the garage or running a barbecue in the garage, for instance, then that carbon monoxide can affect people in the garage, but it can also move into the house and affect the concentrations of carbon monoxide inside the house. So these are some exposure guidelines. They're from various sources, including Health Canada, the World Health Organization, and OSHA and the US EPA. So for carbon monoxide, the lowest end that people see symptoms at or give a warning about is 6 parts per million, which is very low. And that's a WHO 24-hour limit. And it can go up to, well, they say the high end is 9, but Health Canada, for instance, says 10. So in the order of 9 or 10 is what people say you should be exposed to over 24 hours, or you should avoid exposure higher than that over 24 hours. There are exposure limits from Health Canada for 1 hour, such as 25 parts per million, which means you can be exposed to carbon monoxide slightly higher if the duration is shorter. So in all carbon monoxide exposures, there's 2 things that have an effect. One is how much carbon monoxide is in your breathing zone, and 2 is how long that level sustains itself. So you can have a short high exposure, or you can have a long-term low exposure, and the results may be quite similar in terms of the health effects on your body. Okay, so there's a bunch of health effects, and as we pointed out, it depends on both the amount of carbon monoxide in the air you're breathing plus the duration of time that you're breathing that level. So I would say that a low-level exposure would be like less than 25 parts per million per an hour or less. And the symptoms then are quite limited. There have been measured reductions in exercise capacity in healthy people, but there are some more measurable effects on people who have existing conditions like coronary artery disease. And also, under 25 parts per million, if you live in a house and you're in, say, the 15 to 25 parts per million range for days at a time, that really hasn't been investigated too much, but there are clear signs that long-term exposure to these low-level carbon monoxide concentrations may be more significant than we have imagined. So medium exposure is something between 25 and 200 parts per million. And the sort of thing that you're going to see is headaches or dizziness or difficulty in breathing, some confusion. You know something's wrong, you're not quite sure what it is. And these sort of levels should be avoided. The high exposure is in the 200 to 400 part per million and above. And you can die from this. You may fall unconscious before dying, and you may suffer convulsions. So these are severe effects. These are concentrations that you should always avoid because the resulting health effects are severe.
So Don, how is it that CO causes, what does CO actually do to your body?
I'm not a medical person, but the body recognizes carbon monoxide as oxygen to a certain extent. And so the hemoglobin in the blood picks up carbon monoxide instead of picking up oxygen. So hemoglobin carries the oxygen around to the various parts of the body. And if it carries a lot of carbon monoxide instead of oxygen, then the parts of the body expecting oxygen are going to get something which doesn't work as well. So that's called your carboxyhemoglobin level. And most of the health recommendations are based on how high your carboxyhemoglobin level is due to exposure to carbon monoxide.